My name is Jean Heller, and I'm the reporter who broke the story of the syphilis study that was conducted in Tuskegee for 40 years. It started with a tip from a man who was working, I think it was a summer job, for what was then the U.S. Public Health Service. And his job was to do a census of the locations where HIV was most, and syphilis, HIV and AIDS were most prevalent in San Francisco, which neighborhoods. And somewhere along the line, he got wind of the possibility that this study existed. And he wrote to his supervisor in Atlanta and asked about it. And the supervisor wrote back and said, "You've got your job to do. You take care of that. This really is not any of your business." That language, while it doesn't sound on the surface like it's an admission of anything, isn't a denial. It's just saying, mind your own business. And I showed the two letters to my editor. He said, when we were on our way home from covering one of the national political conventions in Miami Beach in 1972. I don't remember which one it was. And he said, when we get back to Washington, I want you to drop everything else that you plan to do and just work on this. And I literally had to kind of go to the library. This was before Google it. And I actually had to go to the library and just research every medical magazine I could lay my hands on to see if there was any mention of it anywhere. And I finally found one. It was an obscure medical journal I had never heard of, which periodically and in very technical terms updated the study. And armed with that, most of which I didn't understand because I'm not a doctor, I was able to go back to the Public Health Service and say, I want to know about this. Sick to my stomach. I mean, I'd spent all this time researching it, almost hoping I would find out that there was no record of it and it wasn't true. But I knew in my heart of hearts there was something to it. And when I nailed it down, as I recall, I cried because I just couldn't believe we would do that to each other. It's only supposed to last for 6 months. And it went on for 40 years. I mean, that qualifies, I believe, as premeditated murder. These men were, when they found out what was wrong with them, they sought help at a clinic in Montgomery. And the doctors in charge of the study would always send somebody to pull them out of the clinic and threaten the clinic with retribution if they ever treated any syphilis victims from Tuskegee. To me, that's not manslaughter, that's murder. They wanted these men to die so that they could determine through autopsies after they died if syphilis affects Black people in a way that's different from white people. There's some belief out there that the government doctors actually gave syphilis to these men. They didn't. They got it the way anybody gets it, through sexual contact with someone else who has it.
So what was the general thrust of your story that actually you were an Associated Press reporter, and your story got picked up by the New York Times, correct?
Every paper in the country, the Washington Post, Washington Star, the LA Times, the Chicago papers, the Atlanta papers, my hometown newspaper. It was on the front page of every newspaper, virtually every newspaper in the country.
And what was the gist of your story?
That for 40 years, the U.S. Public Health Service had been using a population of Black farmers in Tuskegee as guinea pigs in which they were denied treatment for syphilis. It would be very easy to say racism was involved, and it was in that the doctors obviously felt these men were less human. There had to be an element of racism in it. They just didn't care completely. I was getting calls from all over the country, people who wanted to talk to me. Look, it's 52 years later, and you're the third interview I've done this month on this subject. Just doesn't quit, which is fine. I think that's terrific, because the only way we're going to prevent this from happening again is to keep it in the public consciousness. And you're going to help do that. And I'm happy to help you do that. I think it was necessary. I think the federal government had to acknowledge formally that this was a horrible mistake, deliberate mistake, but horrible. But I wish it had happened a lot sooner. Resentful that money that could have gone to help these people and save lives was used instead to help them die for dubious scientific purposes. I don't know what the study cost. We know that that more than 100 men died as a direct result of syphilis. But of course, you contract syphilis through sexual contact. We don't know how many wives, girlfriends, children also died. The other thing that sticks in my mind is a couple of days after the story broke, I got a phone call from a reporter from Jet magazine. And then he said, "You don't sound Black." And it really took me aback. And I said, "I'm not Black, I'm white." And he said, "Then why do you even care?" And it was like he had punched me in the gut. That he would think that because I'm white, I would just dismiss this as, oh, they're only Black people. And I think as much as anything that happened to me in the aftermath of the story, that affected me most. And we're still feeling the ramifications of this. When COVID, when medical science was desperately trying to develop vaccines for COVID, they were having a terrible time finding Black people to participate in the study, because there is a residual serious, deep distrust among a lot of Black people about white medicine. And I can't fault them for that. They mean, they basically, a lot of them, according to the big pharma companies themselves, a lot of these people were saying, "I don't want to take part in any studies. Look what happened the last time." Or words to that effect. And I can't blame them. I can't fault them. I think I might feel the same way. The reason I have been doing things like this for 52 years is that the more people who learn about this, the better the chances are it will never happen again. After the study was disclosed, Senator Ted Kennedy, convened a hearing. It was like a day or two later. to look into this. And out of that hearing came I think it was like 2 years that the National Institutes of Health in Bethesda, Maryland, uh, got a panel together to take a hard look at the guidelines that govern human experimentation. And they made certain rules about allowing people who might become subjects to know exactly what was going to happen to them, what the adverse effects might be, how they were going to be cared for, just the whole gamut. Oh, and it also has to go through a review, a very, very rigorous review to make certain that all these new rules are being followed. If any organization violates those rules, they could lose all federal funding for the rest of their existence. Can you imagine what that would mean to a university? I mean, it's oblivion staring them in the face. And whether I can't believe that those rules and the possible truly dire consequences of violating them can be a deterrent for everyone everywhere. It has certainly helped. It has certainly helped. I had to call a university, which shall remain nameless, about something else. But I wanted to talk to the individual who was the head of their review board. And when he came on the phone, he said, "Are you the Gene Heller?" And I said, "Is there a the Gene Heller?" And he said, "Well, you're the reason I have my job." There is a legacy, but it isn't about me. It's about the people who gave their lives without cause, without fair treatment, without medical care. This isn't about Gene. This is about people like Charlie Pollard, who I remember sitting on a park bench with Charlie. I didn't have any of the names of the participants in the study when the original story broke because the government wouldn't release them. All of a sudden they got hot about protecting privacy. But the names came out as soon as the story broke. And I was back in Tuskegee, sitting on a park bench in the city square with a man named Charlie Pollard. Lovely guy, well-spoken, just as sweet as he could be. And I said, "Charlie, has your life here in Tuskegee changed because of that story?" And he looked me straight in the eye and he said, "This used to be a friendly town. Now people cross the street to avoid shaking my hand." It's no less than they deserve. To feel they have absolutely no reason to feel shame. It's shame for the people who put them through this. That's where the shame belongs. That's where the shame should have been directed. Not at the families, not at the survivors. I know this story will still touch people. I did 2 weeks ago, I think it was. I did one of these with 2 high school students. And their teacher was present in the room when we did it. And when we finished the interview, she came over to the camera to say thank you, and she was sobbing. So all I could think was somebody else to be a watchdog, somebody else to make sure this doesn't happen again. Please, whoever sees this, whoever hears it, whoever can relate to it, please be vigilant. And if you see something so unjust happening again, please say something, complain, scream at the top of your lungs. Don't let this ever happen again in this country. It belies everything the United States is supposed to stand for. We've lost a lot in recent years in terms of respect, a conscience, and it's got to stop somewhere. And I can only do my best to stop it here, to stop this sort of thing here. So that's my story, and I'm sticking to it.